aspect of the chest, in the first intercostal space, 6 sun lateral to the midline and 1 sun inferior to lung 2. To locate it, ask the patient to extend their hand forwards while you apply resistance to their hand in order to emphasize the deltopectoral triangle. First, locate lung 2 in the center of the triangle, then locate lung 1 in the intercostal space, approximately 1 sun inferior and slightly lateral to it. To locate the first intercostal space, first locate the costal cartilage of the second rib, which is level with the sternal angle. Then locate the first intercostal space above it. Lung 5. Lung 5 is the chessi and water point of the lung channel. It is located on the cubital crease of the elbow, in the depression at the radial side of the tendon of biceps brachii. Locate slightly lateral to the tendon rather than immediately next to it. Locate and needle with the elbow slightly flexed, avoiding the cubital vein. Lung 9. Lung 9 is the shoestring, yuan source and earth point of the lung channel. It is located at the wrist joint in the depression between the radial artery and the tendon of abductor pollicis longus, level with heart 7, which is at the proximal border of the pisiform bone. The location of this point is normally given in relation to the crease of the wrist. Since wrist creases are superficial and variable anatomical feature, it is better to locate this point in relation to the nearby pisiform bone. First locate heart 7 at the lower border of the pisiform bone, then find lung 9 at the same level. Lung 6. Lung 6 is the C-cleft point of the lung channel. It is located on the flexor aspect of the forearm, 7 sun proximal to lung 9, on the line connecting line 9 with lung 5. To locate it, divide the distance between lung 9 and lung 5 into half. Lung 6 is in a palpable depression, 1 sun proximal to this point. Lung 7. Lung 7 is the luo-connecting point of the lung channel and the confluent point of the conception vessel. It is located on the radial aspect of the forearm, approximately 1.5 sun proximal to large intestine 5, in the cleft between the tendons brachyradialis and adductor pollicis longus. If the forefinger is placed at large intestine 5 in the anatomical snuff box and move directly over the full extent of the styloid process of the radius, the finger falls into the cleft between the two tendons. Finally, lung 10. Lung 10 is the yin spring and fire point of the lung channel. It is located on the thenar eminence of the hand in a depression between the midpoint of the shaft of the first metacarpal bone and the thenar muscles. Locate and needle close to the border of the metacarpal bone.